Hi, I'm Dr. Poppy Lamberton. I'm a senior lecturer in global health and I'm an expert in parasites and neglected tropical diseases. These diseases affect 1 billion of the world's poorest people and I've been researching them for 15 years. I've worked in affected communities, I've worked in the laboratory and I've also worked at the World Health Organization. Now I'm currently standing in a village called Bugoto on the shores of Lake Victoria in Uganda, and I want to tell the story about a disease called Bilharzia that affects 240 million people. Now, this is a disease that causes extreme illness and sometimes death later in life in adults, but it also reduces physical and cognitive development in children, which really exacerbates the poverty cycle. So the parasite is transmitted when eggs come out in the urine or stool and they hit fresh water such as Lake Victoria and they hatch and infect snails where they reproduce asexually. Then they produce thousands of larvae that are directly infected to humans and burrow into the skin when people are fishing, for example. As you can see, this is a community full of fishermen and people are getting exposed daily. Or for example, when they're bathing or washing their clothes. Now we know that 90% of this community get their water from the lake for washing their clothes and bathing. It's also a disease of poverty, and over here you can see that there is a lot of pit latrines. So, and these pit latrines are very poor in quality. And they're often not used, and even if they are used, when the rains come they wash the contents into the lake and the life cycle is maintained. Now, a lot of neglected tropical diseases have been successfully treated with annual drug mass administration, but for this disease this isn't working. I've worked here for over a decade and basically the infection in prevalence, intensity are now higher than they were at baseline. And so what I'm now working on is trying to improve sanitation. So what we want to know is what is sustainable, what is popular and what is affordable that can be used in these communities that will help break transmission and reduce infections in the next generation of children and give people the healthy start they deserve.